cancer, less than 2 centimeters, is a T1, nothing else going on, and most probably she's going to have excellent results. So we wish her well, do the right thing, and we'll talk about her as the months and years go by. So we have 2 new voices to listen to, and then we'll be right back. You can call us at 1-800-848-9222 if you have questions. 1-800-848-9222 is the number direct to the studio. We're live at the WABC studio.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD called 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're here to talk to Bill on the line. Good morning, Bill. Are you there? Bill?
Yes.
Hi, good morning. How are you?
Hi. Okay.
How are you doing?
Yeah, I heard you talking about me on the radio. And,
well, was it true what I said?
Yeah, absolutely.
So tell the listeners what happened to you and how it happened. And
well, 2006, they tried to do a colonoscopy. They kept telling me, oh, it's just hemorrhoids, and we don't do them until you're 50. Colonoscopies. So,
and you were what age at that time?
46.
Okay.
And I went back to the doctor, and actually his PA said, you need a colonoscopy right away, And I was like, okay. And when I went, they couldn't do it.
And how many years how many years of bleeding had you had by that time?
I was telling them for 3 years, that I was bleeding, and he said, don't worry about it, So, they misdiagnosed, obviously, and when I went, they tried to do it. They couldn't do it. So I went and had some scans done, and he said, well, it's actually spread to your liver. And so they went and did surgery on the colon. 6 weeks later, they did the liver. I was in the hospital for months.
Was not fun, correct?
No, they actually gave me MRSA at the hospital. I almost died. I was in a coma for a month.
We talk about that all the time, about how dangerous hospitals are.
Yeah, they are.
I mean, Bill, you've had treatment with us and treatment with a hospital. How would you compare the difference?
There's no comparison. I leave work at 1:30, hop on the train, zip down there, 10-minute walk to your place. I'd be back on the train in 35, 40 minutes, and back to work.
Now, you had multiple surgeries. I talked about your case. You've had multiple surgeries and chemo, right? Didn't I explain it pretty accurately?
Yeah, except you missed a few surgeries.
Well, I know you had a lot of surgeries. So what is it?
Yeah.
How many surgeries did you have altogether?
Probably 4 major. They had left a catheter in my liver because I had a hepatic pump that didn't work, and that migrated to my duodenum and bust a hole through my duodenum, and I was bleeding internally.
A big complication.
Blacking out and crashing. I've crashed 4 cars in 30 days, passing out.
How would you explain to listeners, and there's, I don't know, thousands of listeners, how radiosurgery compares to surgery, chemo, and your other experiences?
It's you don't even know. I mean, you just go there, you sit, you get in your little frame, and you're out in 15 minutes, and it's just there's no comparison. It's not even like going to the hospital or the doctor. It's just.
What did it feel like? What did it feel like to get a treatment?
You don't feel anything.
Okay.
There's no after effects. You don't even feel tired. It's just you can't compare it. I mean, anybody who is considering surgery, try this first. My God.
And you got your reports this week. Actually, you spoke to the radiologist with me, and we were all happily hearing that news that the 3 cancers we treated in you have all gone away.
Yeah, that's exactly what you had said when I asked you, what do you expect to hear?
Well, that was even better. Usually radiosurgery keeps on working as the months and years go by. It keeps on working, which is different than chemo or surgery. And
right.
Here, the first follow-up, you had fantastic news.
Yeah. I was afraid of radiation initially, over the years. I never really wanted it because I'd see other people that when I was going for chemo and stuff that had radiation, and they were beat up. It's just I didn't want.
But this is different than standard radiation. The people you were probably seeing were getting standard radiation, where lots of healthy tissue was being unnecessarily irradiated because it wasn't focused.
Right.
The big difference with us is with your 3 cancers, we were able to focus on those 3 cancers and not hurt healthy tissues. Did you have any side effects whatsoever?
I don't think so. I just go back to work and go on with my life.
Now, you're a strong man and you work with heavy equipment, right? So was there any downtime other than those 15 minutes?
No, I'd come back and go right back to work.
And you have a loving girlfriend and daughter, and everything's intact, and nothing's upset by radiosurgery, I assume.
No, my girlfriend's planning our wedding now.
Congratulations.
Thank you. Getting married in August. Life goes on, and,
In a good way.
I thank you. I thank you very much.
All right, well, God bless you, and thank you for calling, and we will meet back in 3 months and hopefully get more good news.
Okay, doctor. Thank you.
All right, thank you very much, and God bless you in regards to your family.
Thank you.
We're just about at the end of the hour, unfortunately. We know there's other callers, so if you want to speak to me after the show, you can call me at 212-CHOICES, which is 212-246-4237. If you want that booklet DVD, call me at 212-CHOICES, 212-246-4237. We have 4 more unique radio shows this weekend. They're on 710 Radio WOR. One's at 1:30 in the morning to 2:30. One's at 3 to 4. One's tomorrow morning 6 to 7, and tomorrow night 9 to 10. So be sure to tune in. I'm sorry we didn't get to all the callers, but please call. We want to speak to you. If you have other questions, call anytime. Come in, get that booklet DVD, and most importantly, God bless you, and thank you for listening.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, when you're talking the big C, cancer, a lot of times people have gone through prior chemosurgery or radiation, and it just didn't work or didn't get the desired effects. All of a sudden, you want to get an opinion on what to do. Well, Dr. Gil Lederman treats not only newly diagnosed and recurrent cancers anywhere in the body, but definitely will specialize with those folks who already been through a process that didn't work, and now they're trying to reconfigure in terms of what they can do, and he goes one-on-one with you. In fact, he'll send you an informative booklet, DVD, and arrange a prompt meeting to discuss all choices at his convenient office located on 38th and Broadway in Manhattan. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. And back in 1991, I referred my dad to Dr. Gil Lederman, and he came up with a solution for his medical problem. Harvard-trained radiation oncologist first brought non-invasive stereotactic body radiosurgery to America. He has the longest experience treating cancer using radiosurgery with no cutting, bleeding, anesthesia, or hospitalization. So just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES. Write that number down if you want to refer someone to call, or call Dr. Gil Lederman for that person at 212-CHOICES. That's 212-CHOICES.
This is where New York comes to talk. Legendary 77 WABC, New York. A Cumulus station. The 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 station.